Okay, so we've just hit 12 o'clock. Great. Okay. This is basically part of a webinar series. And this series is the prevention of musculoskeletal injuries. Last time we focused on sitting, standing, kneeling, crawling, and reaching. This time we're focusing on lifting, carrying, and putting down objects. Next month in June, we'll be focusing on pushing and pulling tasks. And then in July, gripping and grasping tasks. So today what we're going to be going through is the impact of musculoskeletal disorders caused by lifting, carrying, and putting down objects, the common risks and the injuries, how do we quantify these risks, and then some solutions. So how can we mitigate or reduce the risk of these injuries? Okay, so if we look at the stats, musculoskeletal disorders account for over 50% of workplace injuries in Australia. And as a result of that, we've got recurring pain, lost productivity, increased workers' compensation costs relating to this, reduced workforce capacity, and the industries that are most vulnerable to musculoskeletal disorders: warehousing and logistics, manufacturing, construction and trade, and the healthcare and aged care industry. Okay, so 60% of serious comp claims are musculoskeletal disorders in Australia, and that makes them the most common cause of workers' compensation claims. And 38% of those 60% are due to body stressing. So next in line is falls, trips, and slips of a person, then being hit by moving objects. But clearly out in front at 38% is body stressing. And I think it's the latest statistics, 2024, say it's reduced slightly down to 37%, but year on year, it's still the number one. So these are the 2024 WorkSafe Australia statistics. So key workers' compensation statistics of 2024 show that 139,000 claims, there's 6.6 million hours that are worked, and $14,000 is the median compensation paid, with 7.2 being the median time lost in weeks. Now, what's interesting is traumatic joint, ligament, and muscle tendon injuries. In terms of the nature of the injury, it's by far the number one prevalence there, with 755,000 claims. And so we've got wounds and lacerations, that's next, but it's less than a third of traumatic joint, ligament, and muscle tendon injuries. So that's why we're focusing on this presentation or the whole webinar series on preventing musculoskeletal injuries. Now, if we break down the statistics into body areas, so you've got the head, the neck, the trunk, upper limbs, lower limbs, and multiple locations. And these are looking at body stressing by body area. The trunk, in terms of numbers, is the number one area. And so the trunk would obviously include the lower back and the mid back. And that's the reason why we're seeing that as number one. And number two is upper limbs, which will include the shoulder, the elbow, the wrist. So these are number one and number two. From our data at WorkStrong, this is what we tend to see, lower back being the number one cause or the number one injuries that we see, followed by shoulders. And so when we think about lifting, carrying, and putting down objects, the typical injuries that we see in those body areas of the shoulder and the lower back, starting with the shoulder, it's shoulder impingement, rotator cuff tendon tears, and the long head of biceps tendinopathies. In the lower back, you can have something like a muscular strain, the facet joint being irritated, or a disc herniation. Now, today we're going to focus a lot on how to prevent lower back injuries, specifically disc herniation, and I'll be explaining what that is shortly. And so disc herniation and other names, or it's otherwise known as disc prolapse, disc protrusion, bulging disc, herniated disc, slip disc. Not many people know this, but it all basically means the same thing, which is this area of the disc, the nucleus pulposus, being pushed back onto the spinal nerve. So what we have here is a normal spine structure starting from the top, the cervical spine, which is the neck. Then we've got the mid back, which is called the thoracic spine. And then in this lower area here, this is the lower back. This is called the lumbar spine. And right down the end there is that hard bony bit on our backside, which is called the sacrum, which actually is made up of 4 different segments, but they're all fused together so it doesn't move, whereas the rest of the spine does move. Now, what we've got is individual bones called vertebrae. So this is 1, 2, and 3. And in between each bone is a disc. And the disc is made up of the annulus fibrosus, which is a strong fiber on the outside. And then on the inside, the nucleus pulposus. Okay. And this is the jelly substance that can actually get pushed back and protrude and cause what's called a disc protrusion or a herniated disc. And you can have pressure you can have pain or a bulging disc without pressure on the nerve. But if it puts pressure on the nerve, then you can start to get nerve-related symptoms, which is burning sensation, pins and needles, and numbness. Okay, so the next thing we're going to do is we're going to start to look at the risk factors for a musculoskeletal disorder. The way I like to view this is just to put it into 2 simple buckets. So the task itself and the individual, okay? And if jumping ahead, if you want to reduce the risk of an injury, you need to look at those 2 factors, okay? If we look at the task, the risk factors with relation to the task are the environment. An extremely hot environment or extremely cold environment is a risk factor. The physical requirements. So the load is the weight or the size of the object being moved, and the movement. So the distance, the speed, and the frequency that you're going to then move that object. These are the physical requirements of the task, and they're factors or risk factors for the risk of a musculoskeletal disorder. And then the last one there, so the task is the organizational structure of it. So the space that the individual is working in, any time pressures, and team handling. So team handling meaning, is this a 1-person task or a 2-person task? So even if it's a 2-person task, that does introduce other risk factors, meaning that you've got to try to coordinate to lift the load, and somebody not coordinating with you can actually increase the risk. On the other side, you've got the individual that is completing the task, and there are risk factors for the individual, like their fitness level. So we break up fitness into strength, flexibility, mobility, and endurance. The age of the individual, so young versus old. The level of their training, so their skill or their experience is another way of explaining the level of their training. So somebody new to the role would be extremely high risk compared to somebody who's experienced. And that's for a number of reasons, but skill or the level of their knowledge of that particular task is the number one. Clothing is not something that most people would think about, but if you've got restrictive clothing and it changes the way that somebody might lift or move, then that's going to be a risk factor as well. And it's surprising, but the number of times that in the past I've actually seen individuals where their pants, they don't have a belt and their waist pants has slipped down a little bit and it blocks off their hip level. So they actually then can't bend properly through the hip and they end up flexing through the lower back, which increases the risk of an injury. And the last one is the anthropometrics of the person. So that's basically the size and the shape of the person. Okay. And so if we want to, the next step is, they're the risk factors. We just went through those, but how would you quantify that level of risk? And the way we do that is we look at biomechanical risk factors. So there's 5 of them. The first one is exertion, which is the force and speed. The second is awkward postures. So that's the position or the angle of the joints. Vibration is whether the whole body is vibrating, for example, somebody driving a vehicle, or something localized. So you're operating a tool or some kind of equipment that has some vibration to it. And the second last one is duration. So that's the number of continuous hours completing the task. And the last one there is repetition. So repetition refers to the frequency of completing the task. And so this is a system designed by Robert Limerick Burgess, who's in Queensland. He's a professor in ergonomics, and they look at this system where they break it up, each of those factors that I just mentioned, into 5. So for example, exertion, which is the force or the speed that the task is being carried out. If there's no effort, you'd give it a 1. Whereas if it's extremely heavy load and you've got to move it quickly, then that would be a 5. And so we do that for all these factors. And then you end up with a total score for that particular task. Over the years, though, I've started to lean a bit more towards, this is a proprietary formula that I probably shouldn't be sharing, but it's okay. So this is a version of that I tend to use. So exertion being the force and speed added to the awkward postures. And then what I like to say is that vibration and repetition and duration, they can all be added together and they're your multipliers. So really, these will have an effect on the exertion and the awkward postures. Okay, and so moving on to how do we reduce the risk? So if you've got, so the question is, do you change the task to suit the individual, or do you change the individual to suit the task? Now, the ergonomist will say, change the task. A personal trainer will say, change the individual. And what do you think an occupational physio would say? We want to do both. Okay, so it just makes common sense that what you should be doing is trying to optimize the task or change the task as best as you possibly can. And so that's obviously looking at the hierarchy of control, starting from the top and then working your way down. But then once you've done that, then you should also be working with the individual and trying to optimize the individual as best you can. I don't think it's good enough that we just turn around and say, oh, we'll try and put some engineering controls in, and if we can't, let's just leave it. I think we should be doing both. That's probably why you're here listening today as well. So if we just go back and we look at all these risk factors here, we want to try to minimize or control these risk factors as much as possible, and then also move on to the individual. Okay. Now, it's interesting to mention as well that even though, so the hierarchy of control, if you picture the hierarchy of control in your mind, starting from the top, you've got elimination, then substitution, and then engineering is the third one. And we're told to start from the top and leave PPE till last. I don't think you actually necessarily need to do that. And I'll give you an example. So if you've got somebody working in an extremely cold environment and they're doing a lot of gripping tasks, then they're likely to end up with a tendon issue, and that could be trigger finger or that could be de Quervain syndrome. But warming up that hand by simply wearing a glove, which you could be deemed as PPE, would be a very applicable early, quick step that you should jump onto rather than just leaving it till last. So it's just food for thought, something to think about. Okay, so if we look at task modification and in the environment, if it's an extremely hot environment, we want to try to ensure that there's adequate hydration. And if it's an extremely cold environment, then you want to ensure that they're wearing correct PPE and they've got layers of clothing. With the load, we can start to think about, is there a way that we can try to reduce the load? So lighter loads would be obviously reduced risk. And that might mean that you need to package the product differently. for example, less items in the box. And this is quite a high level task that would need to be done. It wouldn't happen straight away, and usually might even be a conversation with a supplier. But if the supplier is coming from your own business and you've got control, then you can possibly do that. Actually, an example or a case study around that is that we're currently working with a company that makes doors, commercial doors, housing doors, and the stack that they come in is 3 to 4 meters high. Okay. And so because it comes in that stack that's so high and it's directly transported into their warehouse, when the pickers need to go and pick that, it is broken down into, I think, 2.5 meters high, but it still means somebody needs to then go onto a step up and try to reach above their head height to try and pull down one of these doors. So we're working with the business at the moment to try to think of, is there a way that maybe we can ask the supplier to put like a slip sheet between the doors so that we can then use a forklift to grab that slip sheet and bring it down and lower the height. So then people are lifting from a more reasonable height, chest height. The movement, if we want to then look at the movement, the speed of the movement, we want to reduce the speed by, and you can do that by possibly increasing the number of employees. If you think about production and the speed of production and the speed somebody's working, if you've got 2 people working on one task, then you can get the same volume of work done with those 2 people. And that's a decision that the business needs to make. Distance. So the distance is if you're holding a load or you're carrying a load and you need to move it from point A to point B, then reducing the distance can be a very quick solution to reducing the strain on that person's body. So rather than carrying the objects, let's just say 4 or 5 meters, it could just be taking 2 or 3 steps, 1 meter, and that's going to reduce the number of repetitions that they're going to be doing over the day or the amount of time that they're actually carrying the load. And that could be sometimes as simple as moving the stockpile closer to where the employee is working. And the last one is organizational. So similar to speed and distance, job rotation. So you need to upskill your employees to have a constant stream of new employees. And that means you need a good induction process. So if you've got a good induction and training process and you've got more skilled employees, then they can rotate the tasks around and they're not loading the same muscles or the same joints all the time. And therefore the risk of an injury would reduce. And the last one is the lifting type, so 2-person versus individual. Now that was focusing on the task. And now from moving forward, we're going to be looking at the individual modifications. So you can reduce the risk of an individual being injured by improving muscular strength and endurance, making sure they're warmed up, maintaining mobility and flexibility through muscles and joints, and applying correct manual handling techniques. Okay, so if we go back to that table that we had before, these were the risk factors: fitness, age, level of training, their clothing, and their anthropometrics. Now, some of these you can change and others you can't. So you can't change somebody's age and you can't change somebody's anthropometrics. Okay, but with the anthropometrics, you can change the task or you can match the person to the appropriate task. So it's not something we're going to talk about today, but job matching is something that's quite important. If somebody isn't the right height, it might be, can we offer us an alternative task or an alternative role for that person so that they're not at a physical disadvantage or an increased risk of having an injury. And the same can be said with somebody's age. It sounds like it's common sense. If somebody's older, try to give them a lighter task compared to a heavier task, but it's something that we definitely need to keep in mind. Now, the other factors like fitness, level of training, and clothing, they can all be changed. Clothing might be a simple conversation, and whereas fitness and level of training, this is something that we need to try to implement as a program. So you can implement fitness programs to improve strength, flexibility and mobility and endurance, and training. Okay. And we're going to be talking about training extensively with regards to the technique that somebody should be employing when they're lifting or carrying. Okay. So talking about training, manual handling, task training. We want to find the optimal technique that reduces awkward postures, that is, reduces the stress on joints, muscles, and tendons. We want to train employees on the correct technique. That's step 2. And then step 3 is we should be assessing their technique. So we should assess the individual's technique and deeming whether they're competent or not to safely complete the task, or they're not competent. And if they're not competent, they just need further training until they do become competent. So what this does is training focuses on reducing the risk of awkward postures. So if we think back to those 5 biomechanical risk factors, awkward postures was the second one, exertion was the first one, awkward postures was the second one. So having a good manual handling technique and training that technique will help reduce those awkward postures. So the first question that comes to mind about lifting technique is, what is the correct technique for lifting? And if you delve into that a bit further or take a back step from that, a second question, is there a correct technique for lifting in the first place? Or is it all just a myth? So I'm just throwing it out there. I'm a bit of a Star Wars fan, and we had May the 4th not too long ago. Okay, so the lifting technique, before we delve into that as well, we need to understand the spinal structure. So I'm going to start by just basically explaining a bit more about the spine. We spoke about the different sections of the spine and how in between each vertebrae is the disc. And so this gives you a bit more of a clearer picture of what it looks like with the annulus fibrosus and the disc, the gel substance that's on the inside. So think about the spine being flexible, and it should be, even though it looks like from this position here, it's still and it's rigid. Our spine is meant to move. Most of the flexion, which is bending forwards and backwards, comes from the lumbar spine. Whereas when we twist and we rotate, most of that comes from the midsection of the spine. Okay. Now, the other important thing to point out from this image, what you can see is from the side, our spine is an S shape. And the reason why it's an S shape is because it's like a spring. So gravity is always pushing down on us from the top down, from the top of our head. And if we're in a spring shape, like our spinal column is, then it helps absorb shock and the forces of gravity a little bit better. Okay. So when somebody says, oh, have you got a straight back or not? What we're referring to is actually looking directly from the back. So when we look directly behind somebody and we look at their back, and you can see it on this image here in the middle, we can see that the spine is, or should be, sorry, let's get back. The spine should be straight, okay? And if it's not, it can be slightly deviated left or and we call that scoliosis, okay? And the scoliosis or the bend can happen in the upper back or the lower back, but 80% of the time to 90% of the time, people have a straight spine. Okay. Now, there was a study done back in 1966, quite a while ago, but what they did is they tested to see disc pressure. Okay. So actually, I'll take it back a step. When trying to decide the answer to this question of, is there a correct technique for lifting? What we want to do is we want to explore 2 different factors. One is the actual spine. And from a physics point of view, if we put pressure on the spine, how does it behave? What happens? Okay. And the second thing is in real life, what do we see? Okay. And we call that kind of in the clinical experience. Okay. So from a physics point of view, looking at forces and pressure on the spine, they did this study all the way back in 1966, where they got people in different positions, and with their permission, they actually attached a transducer directly to the disc of their spine to measure the pressure on the disc. Okay, so these are compression pressures that are on the disc. And this is on the left-hand side is the percentage of pressure on the disc. And at the bottom here, we've got the different positions. Okay, so in lying, there's only 25% pressure on the disc. When you go to lying, it increases to 75. And when we're standing, due to gravity pushing down and compressing our spine, there's 100% pressure on the disc. Okay. Now that pressure increases if we then bend forward by 50%, and it increases by 120% from just standing if we're bending forward and holding a load. Okay. And this was the real interesting one, where if somebody's even just sitting down, bending forward and carrying a load, it's actually the worst. And they didn't come up with a reason for that, but I'd say it's because core is not being engaged at all in this instance. And so what that tells us is that different positions do increase pressure on the disc. And even though that was done back in 1966, it was repeated in 1999 in another study that came up with the same findings. And McGill did another study in 2001 where they looked at actual disc herniations. So not only did they look at the pressure, but they looked at when does a disc herniation occur and does the risk increase with different positions, and they found the answer to that was yes. And so if we look at this example here, so this person is bending forward and their spine is rounded through that position, which you can see on this left-hand side here. This is what would happen. So the normal shape of the spine, or the neutral spine, has even pressure across the disc from the back to the front. Whereas when we flex with a load, what will happen is we'll end up with a lot more compression at the front of the disc, and that pushes that nucleus pulposus backwards. And that's what causes that bulging disc at the back of the spine. Okay. And you can imagine like a jam sandwich over here, or a jam jelly donut. If you squash the front, the jam will get pushed out to the back. Conversely, with extension, which is basically bending backwards, if you overbend backwards with a load, rather than putting a lot of pressure on the disc, we actually tend to put pressure on what's called the facet joints. And so you'll end up having a joint irritation or a joint injury. And so as a physiotherapist, the way we fix these two problems is completely different. This would involve more extension exercises like cobra extensions, whereas this one will be more flexion exercises. And so a conclusion for that is that bending forward under load with a flex spine will increase compressive forces on the disc and increase the risk of a disc bulge. So myth has been busted. It is true. And in everyday life, if we look at who are the most efficient lifters on the planet, or everyone in general, really, they all use the same technique. So if you look at that, these are all individuals from different countries, from different places, but they're all lifting the same weight, and the way they're lifting is exactly the same. And I'll put a bet out there that every single Olympic lifter in the world lifts with exactly the same technique. Sure, there's slight variations with the amount of hip flexion or the amount of bend in the knee, very slightly, but they all have the same characteristics, which is a straight back, hinging from the hip, bending through the knees, looking forward. And so from a real world perspective, we can see that the evidence is there as well to say that there is a correct technique for how people should be lifting and bending, and it does make a difference. It does matter. From my experience of 15 years working as a physiotherapist, also, I can say that when somebody does sustain a lower back disc injury, they come into the clinic, they present the same way. The same exercises help benefit them with regards to rehabilitation. And if they bend further forward and flex the spine, it irritates them. It aggravates their condition because they're further flexing through the lumbar spine and pushing that bulge further back. And what we need to do is we need to try to undo that, which most of the time we're actually quite successful at doing it, which is trying to get that bulge to come back in. And notice I've said here that it's bending forward under load. So what I mean by this is you shouldn't expect people to be picking up a piece of paper, which is extremely light, using this technique. So as mentioned before, our spines are meant to flex and we should be doing exercises to actually flex our back, okay? But we don't have a flexed spine when we're under heavy load or when we're trying to lift up a heavy load. Okay, so trying to get your brains ticking and firing with regards to finding solutions. So which one is correct? So which squat technique is correct, number 1 or number 2? And the reason why we have this picture here is because most people say, okay, keep a straight back and bend from the knees. So have a straight back and bend from the knees. But what you can see is in both instances, the spine is straight in both instances, and there is bend at the knee in number 1 and number 2, but which one is correct? And the answer is number 2. And the reason for that is this would be putting excessive pressure on the knees, and there's no hip hinge here. So there's no flexion through the hip. And so a bit of a trickier question, which one of these is correct? So both have straight backs, both are bending from the knees, and both are bending through the hips. And the answer is they're actually both correct. Okay. The only difference between these is this one is bending more through the hips and less through the knees. This one is bending excessively through the knees and less through the hips. Okay. Now, deciding on which one is appropriate for the business will depend on what object is being picked up. Okay. So for example, if it was just a crate or a box that needs to be picked up and it's got handles, the deadlift technique or the squat technique is absolutely fine. However, if the object, like a sheet of glass, needs to be picked up and held vertically, the only option that the employee will have is to actually employ this squat technique, okay? Because they need to have their arms up and facing vertically to try to keep the glass horizontal. Vertically, you can't have the glass horizontal. And so with these employees, you would actually need to check and make sure they've got really good hip flexibility and knee flexibility. Okay. So what's wrong with this technique? So the spine is rounded. And so the same version of this looking a lot better is this one here, where the spine is straight. So we can draw a straight line through there and we can see that the spine is straight and therefore this is going to be a safe lifting technique. Okay. And as mentioned, this is a bit more of a deadlift technique where the shoulders are almost straight down. There's slight bend in the knees, but a lot of bend through the hip. Okay. Another example, spine is straight, which is good, but spine is bent. That's going to increase the risk of a disc herniation. So hip hinging is one of the most important factors for lifting correctly. And this is what we will do to try to train people on how to lift correctly. And this is one of the first few steps. And a tip or a way we like to train people is to get them to hold a broomstick or hold a rod along their back. It'll maintain 3 points of contact, the back of the head, the back of the shoulders, and on the sacrum, on the bottom there. and the stick will need to maintain all 3 points of contact when somebody is squatting. And so if they bend through their back, basically you'll lose contact with the rod. But if you keep your back straight, then you'll maintain 3 points of contact. And then we say, try to stick your bottom out backwards and hips first. So another key point that we look at is the knees. So we haven't spoken about knee injuries, but you can certainly get knee injuries from incorrect lifting technique. The main problem that we see is if the knees are collapsing in. So here we can see that the knees are pointing inwards as indicated by these red lines inside the feet, whereas you want the knees to be going in the same direction of the feet and over the toes. Okay. So what this is called valgus, and this will increase stress on the outside of the knees, which can cause a meniscal tear or irritation to the joint. So pushing the knees outwards is an important step in the direction of the second toe. Now, in terms of the feet, you might get some people that say, okay, make sure your feet are pointed directly forward, but that's an error, that's a mistake. So what we know as physiotherapists is that everybody's bones are slightly different. Everyone's genetic makeup is slightly different. Some people have extra torsion through the hips. Some people's shin bones are actually torsioned or twisted slightly. And so your feet will point in different directions. What we do is we say, okay, you need to make sure that your feet are pointing in the direction that you feel comfortable, and then just make sure that your knees move in that direction. Okay. So I've actually got this checklist of how to lift and move, how to lift and carry correctly. So if you guys want to email me afterwards to get that checklist, I'm more than happy to send that out to you guys. Positioning of the feet shoulder width apart to ensure a stable base of support, bending at the knees and the hips, keeping a straight back, and using your strong leg muscles to lift rather than through the back. Okay. Now, when carrying objects, it's very important to make sure that your wrists stay in a neutral position. So we can see here, as indicated by the green line, that there is a straight line through the forearm and into the hand, through the middle finger, and it should stay like that. If we bend our wrists, and you can see in this indication that the wrists are bent downwards into what we call ulnar deviation, then what that does is it strains the tendons that are at the top there. And if you repetitively do that throughout the day, then you could end up with a problem called Quervain's syndrome, which is inflammation of the synovium of the tendon. And that's because we're basically repetitively bending the wrist up and down like that. And thinking about gripping and holding the object without letting the wrist bend is really important. So it's basically maintaining a neutral wrist position. Okay. Now we want to avoid twisting. So in this scenario here, the gentleman is basically twisting through the hips and through the upper back. Our lumbar spine only actually has 5 degrees of twisting. The rest of rotation of that twisting will come through the thoracic spine. And so we're not meant to load the spine and twist at the same time. So we can twist just like bending down to pick up a piece of paper. Not under load, it's okay. But when we are under load, we shouldn't be twisting. And the other point is we want to keep our shoulders back and facing the same direction as the hips. Okay, next on the checklist is avoid lifting a load from an outstretched position. Okay, so if we stretch out, then just with regards to physics and leverage, the more we stretch out, the more load is going to be placed onto the lower back. So if you're holding an object, the employees should be keeping the load between waist and chest height and keeping it as close to their body as possible. Okay, and avoid twisting while holding the load. Okay, so when we think about carrying, as mentioned, we want to try to keep it as close as possible. This illustration depicts that the load is 3 times as heavy. So between these two, the 4 kilograms is perceived as heavy as 12 kilograms simply because it's held 3 times the distance away from the body. So 60 centimeters compared to 20 centimeters. Okay, and so the green is low risk, keeping the object as close to the body as possible. Amber is arm's distance, and if you're leaning forward, then that's really high risk. So apart from training, the other things that we can do to reduce the risk on the individual is warm-up programs. So warming up helps increase heart rate, blood flow to the muscles, which helps to raise muscle temperature, improves flexibility, and enhances joint mobility. This prepares the body for movement by reducing muscle stiffness and increases coordination, making it less likely that sudden or intense movements will cause strains, sprains, or other soft tissue injuries. So overall, warming up helps improve physical performance and significantly reduces the risk during activity. So this is backed up by studies that show that we do have an increased heart rate, we do have increased blood flow to the muscles, and that there's a reduced risk of injuries. Most of this research comes out from sports physiotherapy. There just isn't enough evidence or studies that are there with regards to the occupational physio realm, but it translates in my mind exactly across whether you're working, doing physical work in a warehouse or you're actually in a gym lifting weights. It's exactly the same thing. You're both lifting objects and you both need to warm up. So the characteristics of a good warm up is that we should have a gradual increase in intensity. So starting off slow, making the movements slow and controlled, and then building them up. We don't want people doing sudden bursts of movements and actually causing an injury when we're trying to reduce it. So start off slow and build up the intensity. The movements should be activity specific. So incorporate movements that mimic the actions of the tasks that you're going to do. We should be making the movements dynamic. So in a warm up, you shouldn't have what we call static stretches. So for example, if I put my arm across my body like this and I'm doing a shoulder stretch, we shouldn't be doing this as a warm-up exercise. This is an exercise that should be done at the end of the day to stretch muscles, but not at the beginning of a day. So at the beginning of the workday, there should be movement. So for example, if I was to alter that, it would be maybe moving backwards and forwards across my body 10 to 15 times. And that's what we call dynamic stretching. That movement is what increases the warmth of the muscle and increases the pliability of the muscle tendon relationship. Number 4 is muscle activation and neuromuscular engagement. So basically, we're trying to wake up muscles and get them engaged and get them activated. And you can do that by also doing some balance exercises as well, or some reaction exercises. Okay, and then number 5 is joint mobility work. So that involves controlled movements through the full range of motion. If we're thinking about lifting, carrying, and putting down objects, we should be focusing on the hips, the knees, the ankles, and the shoulders. The duration should be 5 to 15 minutes, so long enough to raise body temperature and increase circulation, but not so long or difficult that it's going to cause fatigue. And we also need to think about psychological preparation. So help focus the mind, transition from rest to activity, and it mentally prepares the person for performance. Okay, so apart from a warm up, the next thing that we can do is we can focus on functional strengthening of the individual. So core strengthening, shoulder strengthening, and glute and leg strengthening would be the focus if we're trying to prevent injuries related to lifting, carrying, and putting down objects specifically. Okay. And what this addresses is the risk factor of exertion. So the load being placed onto the body. So if we can get the employees to engage their core and have a stronger core, have stronger shoulders, and have stronger gluteal and leg muscles, then their capacity for lifting is going to increase. And therefore, if they're lifting the same load, they're going to have a reduced risk of injury. So core strengthening, the reason why it works is it enhances spinal stability and it reduces load on the lumbar discs. Okay. So the main muscle of the core is actually not the six pack. Okay. But rather a muscle called transverse abdominis, which is the one that's highlighted here. This is looking at the body from the front, and that same muscle wraps around to the back. So the transversus abdominis is a muscle where its fibers run transverse or across the body and then wraps around the body. So think about in the 1800s, like a lady's corset, where it would wrap around the whole midsection of the body and it would be really tight. That's the same principle that we have here with this muscle. When the fibers do activate and the muscle activates, it actually squeezes in onto the spine and helps reduce that compression of the spine. So you can imagine that if you're pushing in from the sides, then the spine separates by going up and down, and that reduces pressure on the discs. So it's important to activate and strengthen this particular core muscle. The second thing is core strengthening helps improve functional movement and lifting mechanics. Okay. Now, these are what's called McGill's top 3 core strengthening exercises. So McGill was the fellow who back in 2001 did that study where if you put your body into different positions, it actually increases the risk of a disc herniation. So he came up with 3 different exercises to improve core strength and help reduce the risk of that disc herniation. And so what we've got here is what we call Supermans or alternate lifts. We've got a side plank. And then here, what we've got is straightening out the leg, but we're trying to make sure that the pelvis doesn't move in this exercise. And so these are the exercises that we use to improve core strength in the workplace and reduce the risk of a back injury. And here we've got a front plank, which also helps activate the transversus abdominis, and it reduces the incidence and recurrence of lower back pain. So there's plenty of evidence here. This is one of the strongest ones. So a systematic review is basically reviewing all the studies that are actually out there. It's not just one study. And so this concluded that core stabilization exercises are more effective than general exercise in reducing pain and improving function with people that have lower back pain. The third thing we can do is we can do muscular releases and stretches with individuals. So the way we would do this is we would reduce myofascial tension and improve muscle function. The second thing is enhance flexibility and range of motion. And the third thing that muscular releases and stretches do is it promotes normal muscle activation and posture control. Okay, so when we think about muscular releases and stretches, try to think about massages and releases to your muscles and your tissue, and stretches is stretching out the muscle and the myofascia. So most people understand what muscle is, but fascia is a specialized connective tissue that surrounds and supports and interconnects muscles through the body. So if you take a muscle like this one, the bicep of the arm, and you take it out, you've got a group or bundles of muscle fibers. Then you've got individual fibers, and then inside those individual fibers, you've actually got filaments. Okay. But what encapsulates these is tissue called connective tissue. And specifically around muscles, this connective tissue is called myofascia. And recent studies, this is over the last 10, 15 years, so that's when I say recent, they've realized that there's actually what they call what they term trains or connective tissue trains that connects the myofascia from one muscle group to another. And these trains run across the body diagonally as well as up and down through the body, as you can see in this image by the blue lines. And stretches can actually help release that tension and improve mobility through the joints by stretching this myofascia. And so the way we do muscular releases and stretches is through 3 different programs. The first being static stretch programs. So holding a muscle in a stretch position that is mildly uncomfortable. And so when you do this stretch, you want to hold for at least 30 to 45 seconds and with mild discomfort. Okay. And the second thing is trigger point massage releases. We use a trigger point massage ball. So we teach employees how to and where to place a trigger point massage ball to release tension, in this case, the gluteals. And the third is using a foam roller to massage out the myofascia to release the myofascial tension. And this is one of the most common myofascial releases, which is an ITB release for the leg. And working on all of these will reduce the risk of injuries related to lifting, carrying, and putting down objects. Okay, so that's the end of the presentation, guys. I hope you enjoyed it. We do have time for some questions. I'm happy to stay a little bit longer. So if you want to pop in any questions into the chat or the Q&A box, feel free to go ahead. And I'll just hold on to this screen here while I'm waiting for some chat questions to come through. But if you scan that QR code there, basically you can book in a free 30-minute discovery session with myself or another from my team. And we can basically go through any questions, any queries that you have related to muscular injury prevention or early intervention physiotherapy, where we operate across 3 different states in Australia. So Queensland, New South Wales, and Victoria in the capital cities. So we're able to get across to all the sites that you might have. But yeah, feel free to book in a free discovery session. We'll be happy to answer any questions or queries that you might have. So I'll just stay on the line now the next 5-10 minutes, and I can answer any chat questions that you might have. Okay, so there's a couple of questions that we've got here. Sit up. I think that's supposed to be sit up. So are sit-ups no longer in vogue for core strengthening? During my 20 years in the army, sit-ups and push-ups were the go-to exercises. Certainly suffering now. Yeah, good question. So yes, definitely sit-ups is not the go-to for core strengthening. Those exercises that I showed before, so more planking style exercises, going to engage the core more, and even actually doing exercises like a deadlift will improve core strength. And that's actually more effective than doing a sit-up. So doing a sit-up really only strengthens the rectus abdominis, which is the 6-pack muscle. And all that does is help you curl up. But functionally, that's not important. We really don't need to curl up that much during our everyday life or during work. And so doing more plank style exercises is better. Push-ups are still effective. So yeah, you can keep doing the push-ups. How long would you recommend I think that's pre-start stretching? Okay. Be careful. So we don't want to call it stretching. That was probably a question came before that information came out in the presentation. We don't want to do stretching that's static. We want to do what's called dynamic stretching. And minimum would be 5 minutes, and I would go up to 10 minutes. So most of our programs at the moment run around 7 to 8 minutes, and that's enough time as long as the person is continually moving throughout the program to warm up the appropriate muscles and joints. Thank you so much for an informative webinar and have a meeting to attend. You're most certainly welcome. Thanks, Vanessa. From Denise, we have, from Neil. So if twisting with a load is wrong, how do you get a parcel from one position to the other position, like in the slide with the two pallets and shifting the load? Yeah, very good question. Okay. So what it means is if you want to move, what Neil is asking is if we want to move an object, and I'll just go back. Yeah, so if we wanted to move an object from one side to the other side rather than twisting, what I would recommend is, first of all, standing side on to the left, to where you're picking up the object from, to the right. And then rather than twisting, actually shuffling and turning your feet. So moving your feet to then face the direction that you need to go, and then moving your feet to face in the other direction. And that way there's no twisting through the spine. It's movement through the feet. And what you would do is, if you're standing one way, then halfway throughout the shift or every half an hour to an hour, switch sides. Thanks for the presentation. You're welcome, Denise. Your email address for checklist. Yep. Okay. I can put my email address in the chat now. If you have any questions, feel free to send me an email and I'd love to help you. And I think that's it. Thanks all for attending. So next month, we're going to be focusing on pushing and pulling tasks and basically going through the same evidence, going through tips, strategies, and tactics on how you can prevent injuries that are caused by pushing and pulling. I look forward to seeing you guys then. And don't forget, if you do have any questions, you've got my email address there in the chat. So it's just amansueto@workstrong.com.au. And if you want to check out our website, I think it was, there on the last page, workstrong.com.au, and we'll be able to help you guys out with any programs that you might want to have. All right. Thanks very much, guys. Have a great afternoon and a great week. Thank you. Bye.